An outbreak of cholera in the Artibonite region of Haiti has resulted in more than 1,500 cases and 138 deaths since Tuesday, according to reports received by the Pan American Health Organization, or PAHO. These are preliminary figures, and we expect them to change. Specimens from hospitalized patients were rapidly tested by Haiti's national laboratory in the capital city of Port-au-Prince and were subsequently confirmed to be actually cholera in the same lab, which is supported by the Centers for Disease Control in Atlanta, Georgia. The reported cases and deaths have come primarily from areas where there was no direct damage from the earthquake, but where there are vulnerable populations living in poverty. We do not know yet if the cases are occurring in the temporary settlements that sprung up, housing people after the earthquake displaced on January 12th. We are diligently looking, however, for any additional cases in particularly these vulnerable communities. Cholera is transmitted through fecal contamination of water and food. In places where there is infrastructure damage, the lack of safe drinking water and poor sanitation and hygiene can increase the risk of cholera, as well as numerous other diarrheal diseases. Fortunately, cholera is easily treatable, and if patients are given oral rehydration salts promptly to replace those lost fluids, they can nearly always be cured. In some small percentage of people, cholera can cause very severe dehydration, potentially leading to death. In these cases, intravenous administration of fluids is needed to save the person's life. Outbreaks can be mitigated and deaths can be reduced through several measures that are effective with community participation. Human practices in personal hygiene and food preservation have a major impact on the occurrence and also the severity of these outbreaks. So really the bottom line in this response to the current outbreak is to minimize the number of people infected through the mitigating measures such as frequent hand washing, personal hygiene, safe water use, and food preparation, while at the same time minimizing the number of deaths through effective case management that prevents this severe dehydration. Cholera is considered an immediate health risk after disasters when cholera is already present in the affected area, when cholera is already endemic. However, in Haiti, no cases of cholera have been reported for many, many years, so we were not expecting to see the disease based on previous experience. Fortunately, however, surveillance monitoring for clusters of acute diarrhea was ongoing, but up until now, we had not seen large clusters of acute diarrhea, particularly of this size. The preliminary case fatality rate is over 9%, and we expect this figure likely to change. In support of the local and national response, PAHO has mobilized epidemiologists and other experts from its office in Port-au-Prince and from other countries in the region to investigate and manage this outbreak, particularly experts who've had experience in managing cholera cases. PAHO is ready to provide the needed supplies identified by the Ministry of Health. PAHO currently has medicines and supplies in stock at our Promes warehouse, which is located at the Port-au-Prince airport, including some 750,000 packets of oral rehydration salts, enough to treat approximately 100,000 cases of moderate diarrhea, and enough intravenous fluids to trace some 4,000 cases of severe diarrhea. Promes also has 300,000 courses of antibiotics if needed. Haiti will need more supplies as cases continue to emerge. PAHO is working very hard to ensure sufficient supplies will be made available as we see more cases. PAHO is also collaborating with the health cluster partners including the Cuban Medical Mission, MSF, the MINUSTA, OSHA, USAID, the U.S. Centers for Disease Control, UNICEF, and other governmental and non-governmental organizations responding to this outbreak. PAHO is also coordinating closely with health officials in the U.S. and Canada, including the Department of Health Human Services, the State Department, the CDC, NIH, the FDA, and USAID in Canada. And in Canada, with Health Canada, the Public Health Agency Canada, and CEDA. I think I'll stop there and take any questions that you may have. Thank you.
Thanks, Dr. Andrus. Ambassador Brutus, if you'd like to make your statement.
Thank you. On behalf of the Haitian government, I would like to begin by expressing appreciation to all for the support Haiti has been afforded since the beginning of this cholera outbreak. I would like to confirm that the Haitian government is mobilized at the highest level to face this new challenge. This morning, the Minister for Public Health and Population, Dr. Alex Lassène, gave a press conference to alert the population with respect to a cholera outbreak that has so far caused 138 casualties, with many in the Artibonite region and the remaining in the city of Mirebalais in the Plateau Central. Another 1,500 people are currently contaminated by the bacteria and are receiving care. Minister Lassène stressed that the government is taking all necessary measures to contain and stop the spread of the disease beyond the affected areas, especially given that the cholera bacteria has never before found in Haiti in the recent years. The government is doing its best to provide potable water to the population of Artibonite. In this regard, Minister Lassène announced the creation of a multi-sectorial commission that has already started working, led by the Minister of Public Health and the Interior, and comprised of experts and institutions from Haitian civil society, as well as international organizations such as PAHO. Health agents and other experts have been dispatched to the Artibonite region and the city of Mirebalais. An intense information campaign to sensitize the population and provide best practices under such circumstances has also been launched. Minister Lassène promised a press briefing every day to keep everyone informed of the evolution of this challenging situation. Again, thank you for your interest.
Thank you, Ambassador. And now we'll take any questions from journalists in this room and then remotely. If you'd raise your hand and identify yourself, please, and speak into the mic. Thank you.
I'm Melinda Yo with Reuters Television. About an hour ago, before leaving the office, I listened to the WHO representative in Geneva, who said that as of a week ago, there were reports that there was cholera in Haiti. And you mentioned that began testing on Tuesday? My question relates to, why has it taken this long to find the cholera? If it devastates in hours, why did it take so long? And to the ambassador, there's reports in the affected area that the people they have no water, that they're begging for water. What does your government plan on doing about that? Thank you.
I'll take the first part of that question. We have a surveillance system set up throughout the country that was markedly enhanced in response to the earthquake and has been continuing since. And we've had sporadic reports of diarrhea. In terms of the way you handle reports, you may have reports that indicate this is a normal circumstance. Children get diarrhea. There's no excess mortality or hospitalizations. It's a part of life. We had no report prior to this that marker or that indicator had substantially changed until, I believe, Sunday, when there was a suggestion that there may have been increased number of cases. And we were following that very closely. So the information you convey about having positive tests as of a week ago is unknown to me.
What I can see about that, if I understand, this morning I heard my Minister of Health, he said the first case, they were aware of that this Tuesday for the first cases in Haiti. And about the second question, if I understand, the Haitian government is taking all measures to give potable water for all people in this area, Artibonite and Plateau Central.
And if I could add, thank you. If I could add, one of the major challenges in a situation like this is to deal with rumors. And you can't just let a rumor come and not act. You really have to have a systematic approach to dealing with rumors to either confirm it's true or it's not. And that's a challenge that we face. So when we hear rumors that there's no available water in particularly a resettlement area, we have to investigate. And I have to say that in good faith that that's what we do. Yeah.
Thanks, Dr. Andrus and Ambassador Bruce. Any other questions from journalists here? If not, we have a question by electronic means from the Associated Press, who asks, it's really a five-part question, but let me give you two parts first. One, how much worse can the outbreak get, and are there reports of cholera elsewhere?
Thank you, sir. This outbreak is likely to get much larger, given our experience with cholera epidemics in the past, particularly in a population that has really no protective immunity, not having been exposed recently to cholera. So we expect it to get bigger, and we have to expect that and react to it. And fortunately, we have a partnership that's never been stronger as a consequence of the earthquake. And it's a disease that can be prevented if community participation is engaged to its fullest. And once it occurs, it can be easily treated if we provide the oral rehydration salts and fluids to prevent that severe diarrhea. So I think we have all the things in place to deal with something we know will get bigger.
The other part of the question was, what is the status of the medical personnel in Haiti, and how much more is needed, or how many more medical personnel will we need for this, and where will they come from?
Personally, I cannot give a good answer to this question. What I know, I heard that this morning, the government expects more support from the international community, because now they are overwhelmed by the situation. 1,000 people at the hospital in Semak, it's a lot for what we have in this area. And I'm sure there is also some effort from the medical association in Haiti to bring more support to the Haitian government.
So we don't really know yet how many more doctors we will need to confront this epidemic, do we?
We have no exact number, but we need to monitor it as we did with the earthquake and be able to respond. We're already receiving a number of requests from countries around the hemisphere offering support. And we know that there is that backup. The important thing, though, is to help develop the local capacity to respond using these relatively simple measures, if well managed, to prevent the severe dehydration.
Okay, and the last question from the Associated Press is kind of a general one. Is Haiti well prepared to confront this outbreak?
I want to say one word. I was with someone in my mission, Haitian mission. We said this morning, the best thing, we have a true leader at the head of Ministry of Health in Haiti.
Okay, any other questions from journalists in this room or elsewhere? We do have one more, and then we'll repeat it.
República Dominicana está preguntando que qué medidas están tomando en la frontera.
Okay, journalist is asking what measures are being taken on the border of Dominican Republic and Haiti, if any.
There are several measures. There have been mobilization of teams to be sure that the health centers and hospitals along the border are adequately supported, that if the outbreak was to spread there, that they would not be overwhelmed with the situation. So there's a lot of activity going along the border, but equally important is the call for action for Dominican Republic to be on guard, because it's one island, and we know that with other infectious diseases on the island that things go both ways across the border, and we need to be prepared. So that everything is being done that can be to alert the communities in the Dominican Republic of the outbreak in Haiti and the risk for spread.
Thanks, Dr. Andrus. I'm told we also have the ambassador of the Dominican Republic in the room who may also be able to answer any other questions. Are there any other questions here? Please, go ahead.
I just wanted to ask, do you have any recommendations to people who will be getting news from this conference as to what they can do immediately? People in Haiti.
Yeah, one of the simplest things they could do is frequent hand washing, personal hygiene. That does wonders. Safe water. Chlorine is being provided, so to take advantage of those measures that will ensure that anything ingested, whether it be water or food, is properly prepared, and that the source of the water is safe and adequately treated. I think, and the frequent hand washing, that will go a long way in preventing infection, and also to seek the care of the local community if you suspect diarrhea in your children. Yeah. The oral rehydration salts are very, very important in this situation, and it's a very simple technology that costs pennies that saves millions and millions of lives. The experience we have, and mothers and families can manage that situation if they know about it and they use them correctly.
Thanks, Dr. Andrus. Do we have any other questions? The other OAS ambassadors, or perhaps the Honorable Albert Rondin, is also invited to ask questions as well. Now we can open it beyond journalists. Okay.
I just wanted to say, Dan, that in addition, the question that came up about the Dominican Republic, PAHO is organizing and sending a team of epidemiologists and other public health specialists to the Dominican Republic as well to help them with their preparation and measures. So that is also happening.